Upper cervical chiropractic is a specialty inside of the chiropractic profession that deals with an area of the spine called Atlas or C1. And that's just right behind the ear here. On this model, you can see it. Here's the base of the skull, and this is Atlas C1 right here, and the area of the spinal cord that is affected behind it. And Atlas C1 is such a neurologically dense area that I like to refer to it like the main breaker switch of the spine. So similarly to your home, if the main breaker switch is off there, you can toggle all the rest of the breaker switches but not have power to those rooms of the home because that main breaker switch is off. So just like that in your body, Atlas C1 is so neurologically important that if there is distress there, subluxation as chiropractors refer to it, then you're going to have trouble getting good results in the rest of the spine, even with the very best adjustments. And so some of the signs that we see that show that Atlas C1 is an issue physically is that there will be tension at the base of the skull. There's a head tilt, a shoulder tilt, a hip tilt, and that hip tilt causes one leg to draw short. It's a muscular shortening because of the tilted pelvis. That causes more weight to go to one side than the other. And with more weight on one side than the other, the body doesn't like that. The body doesn't like the eye line to be tilted. So there's a compensation that happens in the body that puts tons of stress right at the low back. And so that's physically what's happening in the body. Physiologically, there is distress happening in the organs and tissues as well. And because this Atlas C1 connection to the whole rest of the body, that's why we always start with that area and recommend that all of our patients, when they refer their friends and family, refer to a chiropractor that is able to address Atlas C1 on a specific level. That area is always primary. When Atlas C1 is subluxated, that area is always the primary area that we have to work. We have to get that main breaker switch back on before we can have significant results in the rest of the body. That's why we start there, and anytime that area is showing new stress with any of our patients, we will always go back to adjusting that area first, and that's part of the reason why we get such great results here at HealthWorks.